Bladder cancer is one of the most common types of cancer affecting thousands of people each year. But what exactly is bladder cancer? What are the treatments, surgeries, and medications available? And what are the causes and side effects? In today's video, we'll break it all down for you, so let's get started. Bladder cancer occurs when cells in the bladder lining, called the urothelium, start growing uncontrollably, leading to the formation of tumors. The bladder is a hollow organ in the lower abdomen that stores urine before it's excreted from the body. Most bladder cancers start in the inner lining of the bladder and can spread to deeper layers of the bladder wall. Bladder cancer is categorized based on how deeply it invades the bladder tissues. There are non-muscle invasive and muscle invasive bladder cancers. The non-muscle invasive type is easier to treat, while the muscle invasive type is more aggressive and can spread to other organs. Now let's talk about what causes bladder cancer. Several factors can increase your risk of developing bladder cancer, including smoking is the biggest risk factor. Cigarette smoke contains harmful chemicals that enter the bloodstream, filter through the kidneys, and get stored in the bladder, where they damage the bladder lining over time. People who work in industries involving dyes, rubber, leather, and paint are at higher risk due to prolonged exposure to harmful chemicals. Long-term bladder irritation or infections, such as those caused by urinary catheters or recurring UTIs, can contribute to bladder cancer. Previous cancer treatments, especially radiation therapy aimed at the pelvic region or certain chemotherapy drugs like cyclophosphamide, can increase the risk. A family history of bladder cancer or inherited genetic mutations can also make you more susceptible. The symptoms of bladder cancer can vary, but the most common signs include blood in the urine or hematuria is the most frequent symptom. It may cause urine to look red or cola-colored, but sometimes the blood is not visible and can only be detected through lab tests. Patients may feel the urge to urinate more often or experience a burning sensation while urinating. Pelvic or back pain tends to occur in more advanced stages of the disease. These symptoms can also be associated with less serious conditions, so it's important to consult a healthcare professional if you experience any of them. Bladder cancer diagnosis starts with a detailed medical history and a physical examination. Afterward, the doctor may order one or more of the following tests: urinalysis and urine cytology. These tests check for blood, cancer cells, or other abnormal cells in the urine. Cystoscopy. A thin tube with a camera is inserted through the urethra into the bladder to look for any abnormal growths. Biopsy. If a tumor is detected during a cystoscopy, the doctor may take a small tissue sample to determine whether it's cancerous. Imaging tests. CT scans, MRI, or ultrasound can help the doctor see if the cancer has spread to other parts of the body. Once bladder cancer is diagnosed, treatment depends on the stage and type of cancer. Let's go over the main treatment options available. For early-stage, non-invasive cancers, a procedure called TURBT is often performed. This involves removing the tumor through the urethra without cutting through the abdomen. For more advanced cases, surgery to remove part or all of the bladder may be necessary. A partial cystectomy removes only the cancerous part, while a radical cystectomy removes the entire bladder along with nearby organs like lymph nodes. Chemotherapy is often used to treat more advanced bladder cancer, especially when it has spread beyond the bladder. It can be given either before surgery to shrink the tumor or after surgery to kill any remaining cancer cells. For non-muscle invasive cancer, intravesical chemotherapy is an option, where the drugs are directly placed inside the bladder. Radiation therapy is used to destroy cancer cells with high-energy radiation. It's often used when surgery is not an option or combined with chemotherapy for a more aggressive approach. Immunotherapy helps the body's immune system recognize and destroy cancer cells. BCG, Bacillus calmette-guerin, is a type of immunotherapy placed directly into the bladder to treat early-stage bladder cancer. There are several medications used in the treatment of bladder cancer. The side effects of these treatments can vary depending on the type of therapy. Chemotherapy drugs like cisplatin or gemcitabine can cause side effects such as nausea, hair loss, and fatigue. These drugs attack cancer cells but may also harm healthy cells. Immunotherapy using BCG can lead to symptoms similar to a mild flu such as fever and fatigue, but is generally well tolerated. Each treatment has potential side effects, but they can be managed with the help of your healthcare team. it's important to discuss any side effects with your doctor. Although not all cases of bladder cancer can be prevented, there are steps you can take to reduce your risk. As we mentioned earlier, smoking is the leading cause of bladder cancer. If you work in industries with high chemical use, take safety precautions like wearing protective gear. Drinking plenty of water helps flush toxins out of your bladder. If you've already been treated for bladder cancer, regular follow-up tests are crucial to check for recurrence. Bladder cancer has a high chance of returning, so ongoing monitoring is essential. Bladder cancer is a serious condition, but early detection and treatment can greatly improve outcomes. If you or someone you know is at risk or showing symptoms, don't hesitate to see a healthcare professional. Thanks for watching. If you found this video informative, make sure to like, subscribe, and hit the notification bell for more health-related content. Stay informed and stay healthy.